Thank you for choosing to watch this video today. We are going to talk about cardiac electrophysiology. This is a very new term and a lot of you may not have heard this term, and I would like to talk about it today because I am a qualified, experienced cardiac electrophysiologist. I am Dr. Saravanan, a senior interventional cardiologist and a cardiac electrophysiologist at Fortis Hospital, Arcot Road, Vadapalani, Chennai. Cardiac electrophysiology is an exquisite area of heart treatment, cardiac treatment, and I trained to do this in the UK, in the University of Oxford Hospitals and in Manchester. And I have a passion to do this because I wanted at one point to be an electronic engineer, and this is as close as I can get to electronics in the medical field. Here in this situation, what we are doing is to investigate the electrical circuitry of the heart and fix the problem. A lot of people suffer from palpitations where the heart suddenly goes bang 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 thumping, and they think, oh, what is that? Maybe I was scared, I didn't eat well, I ate too much, I drank this, I did that. But often it is none of that, and very often people tell me it's gastric, and I don't know what that gastric is, but often it is due to an electrical disturbance in the heart. Our heart is a very exquisite mechanistic pump which requires electricity and fuel to continuously act. The fuel comes through the blood flow, which is taken by arteries around the heart, and when those arteries block off, that is where we get heart attack. That's a completely different than that's a plumbing. Then you got the electrics, the wiring of the heart. When the wiring of the heart is misbehaved, that is when you get palpitations. Often, the electricity of the heart is driven by the need of the body. So if you're running up the stairs, you will need extra heartbeat. Your body, your brain, your heart, everything is so intricately linked to each other that you will get those extra beats that you need. So in order to do that, we need to increase, the heart needs to increase its electrical output. And it does that all the time. But there are times when some patients may be born with it and some patients may develop it, that you may have certain irregularity of the electrical circuit of the heart. And when that happens, you will get these abnormal palpitations where your heart will be beating fast when you are not doing anything. When you're sitting and watching a television, suddenly the heartbeat will go bang, bang, bang to 130, 140, as if you have done a marathon running. And that leads to very unpleasant sensation. Not only is it unpleasant, sometimes it can be dangerous. Sometimes it can lead to the heart suddenly becoming weak, leading to what is called tachycardia-related cardiomyopathy, which leads to heart failure and the heart suddenly stops pumping. Or sometimes it can even stop the heart suddenly. And when these things happen, obviously it's catastrophic. So whenever you get this symptom of palpitation, please do not ignore it. If you come to a qualified electrophysiologist, me being one of them, you will find that we initially will do an ECG tracing, find out what is wrong with your heart if I can. If I can't, then if there is nothing wrong with that, it doesn't mean that there is nothing wrong. It means that the intermittent palpitation that you are getting is not showing itself up on a standard resting ECG tracing. So we will do more monitoring, more tests to find out what this is. If your symptoms persist, we will give you medicines, and if that fails, that is when I take you to my catheter lab, which is like an operation theater where I put 3 or 4 wires into the heart from the leg. The vein in the leg, in the top of the leg, is where I give some local anesthetic. Either I give there or I give in the neck, sometimes both, and give some anesthetic in the neck, give some anesthetic in the leg, put 2-3 wires into the heart, and then I start testing your electrical wiring of the heart. Once I have tested your wiring, most of the time I'll find out what the problem is. If I don't, then I will induce the problem by giving extra electricity into your heart. And all of this is done with a very big machinery which does programmed electrical stimulations. And then we will get all the abnormal things coming up, showing up as to what the problem is. Once the diagnosis is done, then the fixing is done. So in order to fix the problem, we will then take one of the wires out, and then I will put in another wire which can be heated at the tip from outside, called ablation catheter. It can either be heated or cooled. So recently we have something called Arctic Friend, which is a balloon which uses cryo, which is basically freezing the area and destroying. Whatever we do, heat or freeze, we then destroy the area which is causing the trouble, the short circuit. So for us to do that, as you can understand, I need to be super precise at the point where the problem is, as opposed to the rest of the wiring. Otherwise, I'll be damaging the wiring of the heart, and I will leave your heart with a damaged electrical wiring. And in order to avoid that, I need to do an extremely focused and a very, very intricate job of identifying where the problem is and fixing the problem. And that is what cardiac electrophysiology is all about. There are lots of techniques and lots of different ways of doing this, and broadly we classify them as a 2D procedure and a 3D procedure, where in a 3D procedure I will create an image of the heart, a three-dimensional image of the heart, look at the propagation, the movement of the electricity in the heart, identify where it is breaking, as we call it, and then find the point where it is breaking from normal, and then block that by either freezing or burning that area. All of this is done at general anesthetic with some sedation. It's very safe procedure. I have done it quite a lot in the last kind of 15 years, and I am an experienced expert in the area of cardiac electrophysiology. Very little understanding of this has happened, but it's very important for people to understand. These conditions can either be a big nuisance and affect your quality of life, or they can actually be life-threatening. It is very important to check, particularly if you have the symptom of palpitations, banging sensation, dizziness, fainting feeling, having proper faint. All of this may need an electrophysiological assessment and an ablation treatment. If you or anyone you know suffers from these kind of symptoms, please do not hesitate to contact us in the contact number that's being given, and we'll be delighted to help you. Thank you very much for watching this video.